back to the ASCO Journal of Oncology Practice Podcast. This is Dr. Nate Pinnell, medical oncologist at the Cleveland Clinic and consultant editor for the journal. Now, I don't think there's anyone left out there who isn't familiar with wearable physical activity monitors, or PAMs. I use one myself for long-distance running, and if you don't own one yourself, I'm sure you know someone at home or at work who's counting their steps, tracking their heart rate while they're running or biking, or monitoring their sleep patterns at night. But what does this technology have to offer to cancer patients in clinical research for oncology? Joining me today to talk about this subject is Dr. Mohammed Shalan Beg, Assistant Professor of Hematology and Medical Oncology at UT Southwestern Medical Center, where he's also the co-leader of the Gastrointestinal Cancer Multidisciplinary Team. He's here to discuss his paper titled The Promise of Wearable Physical Activity Monitors in Oncology Practice. Dr. Beg, thanks for joining me today.
Thank you very much for having me.
So, how did you get interested in the topic of physical activity monitors and their uses in cancer patients?
So, as a clinician researcher, I see every day that it's hard to assess a patient's physical activity status, and that's probably the most important assessment which we make when a patient walks into our office. Just the other day, I had a family in my office where the patient and his daughter had a very different account of what the patient's physical activity was at home. With PAM devices, we now have the ability to dive into patients' personal lives and get a sense of what their physical activity was like before their diagnosis and after their diagnosis, and how treatments affect that. So there's a lot less confusion on what that's going to be. So I think this is a really important tool for both clinical practice and for research as well.
Well, I think all of us know the experience of asking a patient how they're doing at home and have him or her optimistically telling us that they're doing great, only to see the spouse or child kind of shaking their head in the background and disagreeing. So I can see where this could be useful. Is there data out there in the cancer field that these can be useful either in clinical practice or in clinical research?
So the data that's out there right now is primarily using research-grade activity monitors or prior generation accelerometers. I think the commercially available PAMs haven't been around for that long for data to mature. Probably the obesity field and the physical activity field is much ahead than the cancer field in adopting these commercial devices, but that data is trickling down, and it's important to recognize that what we know about these devices in the physical activity field or obesity field may not apply to the cancer field, where patients are much more elderly, possibly less technologically savvy. So studies are going to come up in the next couple of years, which will determine whether these devices can be used in the cancer field or how these devices should be used in the cancer field.
And I know you've cited some studies here, for example, in survivorship studies where PAMs have been used actually as a motivational tool. I think that's kind of interesting.
Right. Like you said, all of us have either adopted a PAM device or know somebody who has tried a PAM device, and there is that euphoria, which you get when you open that box and slap it on for the first time. How long that lasts and what effect that has on health outcomes is debatable. So I think whether it stimulates physical activity is a much different question than how can we use the information that it gathers to just tell us how we're functioning. We talk a lot about the Hawthorne effect, where clinical outcomes change just because the observers know they're being watched or the subjects know that they're being watched. In my eyes, the motivational aspect is there. It's probably brief and short-lived, but the effect that it can have on medical decisions and on healthcare is tremendous, especially if we start thinking about potentially these devices being able to upload their information to EMR. I think those applications are going to be very interesting.
And, obviously many patients who come in actually have these already that they're using, or they could just go out to a local sporting goods store and buy something. So are the ones that are commercially available reliable enough or reproducible enough to be used in a research study, say, or is there still more that needs to be done before these can be reliable enough to use in your practice?
Right. So I guess it depends on what you're trying to measure. If we're looking at the absolute steps, where they're 10,000 steps or 11,000 steps, I think that most of the commercial devices do not agree with each other. And that's based on the algorithms that they've used and the technology that they've used in there. In older patients, it may be even more prominent when their dynamics when they walk don't stimulate the device, for example, if they have pain or if they're not swinging their arms as a normal person would. But depending on what your angle is in evaluating a patient, if those absolute quantitative numbers don't matter, the inter-device variability doesn't matter, it's more judging within a patient what type of changes are going on, or looking at minutes of activity instead of number of steps. Applications really vary, but there's a lot of work that we have to do to understand which one of those outcomes are most clinically relevant. Is it the average number of steps? Maybe it's the minimum number of steps or the minimal minutes of activity which matters most for a patient population. So those studies are trickling in, and we don't have a good sense right now. I think the barriers for PAM devices in cancer patients can be broken down into how to handle the charging of these devices if we're thinking that the patients may not be technologically savvy to do that. And then how do you solve syncing issues where a clinic or an office or a healthcare system can get the information they need from their patients' devices and where they can centrally monitor those. Those are, in broad strokes, where some of these devices vary from each other, and then where a lot of the advancements are going to come in the next few years.
So going forward, knowing that this has a lot of potential and that, drug companies and whatnot are very interested in trying to get patient-reported outcomes, the FDA, into their approvals and trials, where do you think this field is going over the next 5 years?
What I would really like to see is for us to be able to use PAMs in clinical trials. I think the area is ripe for that. We spend a lot of money and a lot of time having patients fill tedious quality of life surveys to gauge what their activity is like, how active they are, how energetic they are. And we know when it comes to real patient-related outcomes, they may not be as accurate as we want them to be. Now, wouldn't it be cool for large phase 3 clinical studies to have activity data captured from these wearable devices to show how active patients are in one treatment versus the other? That becomes a much more valuable outcome when differences such as progression-free survival or overall survival are not that high for a lot of the drugs that are approved in cancer nowadays. It could help answer a lot of questions as immune therapy becomes more and more common in the cancer field on how patients are doing and how active they are on one treatment versus the other. But in order to unroll these devices into clinical trials and to validate those outcomes, there's a lot of work that has to happen. That's probably going to take a couple of years. How is the FDA going to recognize these as potential endpoints for clinical trials? I don't think anyone's asking that question in the cancer field, but that would be very, very important. And again, so far, a lot of the studies that are published using activity monitors have used activity monitors for a week preceding a visit or a couple of weeks. With these devices, with them being very cost effective and the automation that they provide, we can monitor patients for months and even years. So the amount of information that we can get in terms of effectiveness of therapies, toxicities of therapies is tremendous. I think we are going to look a lot at the FDA on what type of guidance we have. Typically, wearable device and their data has not been regulated that heavily. But if we're starting to incorporate that data into clinical trials that will be part of IND applications for new drugs, for example, there's a lot of compliance issues which need to be thought through. And we need a lot of the early feasibility clinical studies to come out before that can happen.
Well, I can see that this is a topic that has a lot of potential, but still a fair amount of work to be done to take it from kind of a commercial gimmick to something that's a really hardcore research tool. But I can totally envision a time where we start a patient on a new therapy and kind of also train them to use a downloadable physical activity monitor. And instead of just trusting them to tell us how they did, we can actually see that their activity got significantly worse in the first week after they started it. And we know they're not tolerating it as well as they say. And it really seems like it has a lot of interesting potential just in the day-to-day practice of an oncologist.
Absolutely. And I can see a lot of office visits where the doctor, patient, and family are poring over data on the patient's cell phone in terms of their activity level to get a sense of how they're doing. That I got treatment on this day and look what happened on the day after that or 2 days after that, and it took me X number of days to bounce back. So this will become part of the regular patient encounter. And I really would like to see clinical practices and research teams starting to adopt this, not just as a gimmick or a publicity stunt, but as a real tool which can have a tremendous impact on how we practice medicine.
Well, I agree with you. I think it's very exciting, and I hope it comes soon. So, Dr. Begg, thanks so much for talking to me today on this topic.
You're welcome. Thanks for having me.
And I want to thank all of our listeners out there, too, who joined us for this podcast. The full text of Dr. Begg's paper is available at ascopubs.org/journal/JOP, published online. Don't forget that you can read the JOP and access these podcasts on your smartphone or tablet with the ASCO Journals mobile app, available in the iTunes Store and Google Play. This is Dr. Nate Pinnell for the Journal of Oncology Practice, signing off.